We're gonna do it. Are you ready? We're gonna talk about poop. We are, because guess what? We're doctors and that's just what we do in our office. Digestion is something that we completely overlook sometimes, especially on us as adults, but even our littles, because when they're super little, what do? We change their diapers, we see it all, we smell it all, and we feel it all over. But as they get a little bit older, and then if your little becomes even more independent, then you're not really paying attention to what's really happening with their bowel movements. So I'm here to talk to you a little bit about what might be normal, what might be common, but not normal, and how chiropractic is going to support your digestive tract and make sure that your body is doing what it's meant to do. So we're supposed to have bowel movements. Are you ready? I'm gonna tell you a secret. At least once a day, at least. Maybe twice, maybe 3 times, just depending on how your digestive tract is. There are some of you that I have sat with in this room that give me one of the when I say, how often are you having a bowel movement? And you're like, maybe like every 3 to 4 days. There's even been some of you who have a bowel movement once a week. Oh my God, how is your stomach not exploded? Guys, that's not normal. That might be very, very, very common. And you might have a couple friends who are the same way. And your kid might be the same way, but that's not normal because guess what? If that stuff's not coming out, that stuff is staying in and that stuff is toxic. We don't want stuff chilling in our digestive tract for longer than it's meant to. I don't. Do you? I didn't think so. So if your digestive tract is not working well, the bigger question comes to why? Is it something that you're eating that you have no idea might be stressing your body out? Are you crazy dehydrated and just haven't really paid attention to your water and your mineral intake and your electrolyte intake? Is something mentally, emotionally stressing you out? Are you not sleeping enough, therefore not allowing your body to dive deep into that rest and digest parasympathetic function place? Or are you subluxated? Are the nerves right here in your back, in your spine, that are directly coming to talk to your intestines, your esophagus, your colon, your stomach, your gallbladder, your liver, name it, it has a nerve that communicates to it. So if you have a subluxation, which is a nerve interference in that area, that organ's not gonna work like it should. Now, is it just gonna flatly not work at all? No, but you know how we talk about micro stresses? There we go, that's what happens. Think about that area as like a foundation. If there's a tiny bit of a crack in the foundation, nothing's really gonna go down, but imagine that crack getting bigger and bigger and more unstable, and then boom, you develop that gallstone, you're deviled over in pain, you don't know what to do with yourself, right? We don't want that. We don't want those sudden things to come on because they're all completely preventable. Or your little one, maybe it's on the flip side. Maybe that stool, or maybe this is you as well, is way too loose. Maybe your body's not even absorbing what's going on nutrient-wise, so that's creating a bigger issue. Maybe we've got an underlying bacterial infection there, who knows? But pay attention to your poop. That's just what you get to do. And if your poop needs a little bit of help, call your chiropractor. Let us know and keep us posted on what happens while you're here, of course, and allow us to support your nervous system, which is then going to support your digestive system, which is then just going to make you feel light and airy as opposed to if stuff is stuck. So if you've never been to the chiropractor before and you've got digestive stuff going on, this is your message to take some action.